So today, what I really want to start this today with is talking about diabetes. I am type 2 diabetic, and that is different than type 1. And the thing I want to say up front, make very, very clear, and this was made very clear to me because you had to take diabetic education classes beforehand. It is not your fault. Okay? If you take nothing else away from this, whenever you're hearing it, it is not your fault. All right? Diabetes is a genetic disease. And sure, there's things you can do to help and harm, but it's either in you or it's not. It is not your fault. Okay? Okay. Got that in. Now, I can talk about the type 2 diabetic experience, and specifically my type 2 diabetic experience, because, surprise, like all disabilities, it is a spectrum of things. What is good for me for medication and diet is not good for my friends with diabetes. We have similar medications, but different doses and different types. They all kind of do the same thing, but things work with us differently. Bodies are different. You can get diabetes no matter your size, shape, weight, age. It's in your genes. So, if it if you can eat that box of donuts, by all means, eat that box of donuts. You may not get diabetes. Just putting that out there. Still be careful with your diet and, take care of yourself as best you can. And, yeah. So am, I don't know, fortunate maybe. I don't need insulin shots, and I don't need an insulin pump because I'm type 2. And monitoring your blood sugar is a thing. You have to do. You gotta prick your finger, put a little monitor up, look at that, check your number, has to be within a range. And every 3 to 6 months, depending on how I'm doing personally, I go to the doctor for a checkup, and they check what's called your A1C, which is your blood sugar levels, and they want that number to be around 7, 6, somewhere in there. That's one of the indicators you're diabetic if it's over that number. I've been doing what I can to keep mine down, and sometimes I don't care. Sometimes I have anxiety, I have depression, and I have things for those too. But sometimes I just don't care. And sometimes I'll just eat whatever because it's fine. Tomorrow's my birthday. You bet I'm going to eat cake. Like, yeah, I can take care of myself. The other thing I can do is exercise a little more. If I go over, well, I can walk around and that will help, get my blood going because there's a part of my body that just doesn't work the same as yours. It doesn't function like it should and produce the necessarily things that I need to go on. And so I need to supplement that and keep that down with education. Not education, with medication. And yeah, so I'm now, if I had a chance to exercise more, if I took more opportunities to do it, and if I could afford a gym, I definitely would. Uh, I could probably be pretty well off. And again, that's just my health situation. My friends have to have a very different diet. There's things they just can't eat anymore, or they're not supposed to eat. They can. you do actually get a cheat day every now and then. So, like tomorrow is definitely going to be my cheat day because it's my birthday and I want cake. So, and you're trying to keep your blood sugar in a balance. It's not, it can't be too low and it can't be too high. You need to keep it in this middle area. And that is what's going to be different for a lot of people. If the how to take care of that. The number gets too low, you're out, possibly in a coma. If it gets too high, you're out, possibly in a coma. And that's something I think about a lot. And uh, sometimes it gets hard because I should just be living my life, but these thoughts are like, I need to take care of myself, otherwise, there's this. So, what I do is I bring snack with me. I'm driving on a long road trip. I have something to eat right next to me. I have, peanut M&Ms or what are those nutritional bars called? Fine or kind bar. Just for a quick thing until I can actually get something to eat or get a meal or find a drive-through. And my personal biggest problem is low blood sugar, and you get to a point where you can tell what's about to happen. And so I go to my friends and I say, "Hey, we have like an hour, 45 minutes before I start getting really bad. So we should find a place to go eat." Like if I'm out at I would, when we could go places, I'd go to a film festival up north of me every year with a friend of mine. And, he knew that. And I'd just say, okay, I need to eat at this time. And sometimes I can plan my meals out, like I need to eat every 4 to 5 hours to sort of maintain my level. But uh, sometimes you're okay until you're not. And to have a plan, to have people around you that understand what you need is a big thing. I do my best to take care of myself, but sometimes I may need a little help. I have a card in my wallet that says I am diabetic and it has my medications on it. So that if I do go down, it's some sort of backup, right? And then when I get low blood sugar, it, I start to stutter. I can't concentrate on things. My brain just doesn't want to function, and it's mainly a feeling like in the back of my head, kind of. As much as you can feel in the back of your head. Um, my brain saying something's wrong, we're not okay, and I start to stutter. I start to only be able to focus on one thing. Like you give me multiple options, I can't handle it. I'm done. I just no. Give me the thing. I need carbs. I need the thing to solve this. And if you're just giving me a bunch of options and not just getting me something that gives me carbs, I it's too much. It's just too much. I can't make that decision. I shake and I get angry and frustrated with this, um, and I can't get out of it. I don't know how. It's the anger and frustration is just there, and the ability to not concentrate on anything because I'm trying to take care of myself, or I'm trying to get someone to understand I need help. And when I say someone, I mean sometimes family needs reminders of what I need, and it's not options. It's just help me get a sandwich. That's it. Don't ask me what I want on it. Just piece of bread, whatever meat you have, peanut butter, doesn't matter. Peanut butter being the best. Um, just get me a sandwich. Hand me a bar. I really can't decide what kind. right now, but that's what I need. And I, some of my family, I can tell that, and they know what to do. And then some are like, "Well, do you want this, this, or this?" I'm like, I, I don't know. I can't make this decision for myself right now. And it takes a whole lot of effort to just have a clear thought. And so, if there is someone with low blood sugar and you know you're around that, please talk to them, and hopefully they talk to you and they tell you what they need beforehand. So, if you are diabetic as well, please go and have a plan. Get a backup plan, tell your close friends, everything. It'll mean a world of difference, whoever is there and does that. Um, let's see, what else did I want to talk about around this? Oh, employment. You do have rights in America under the American with Disabilities Act. And when I first had to apply for jobs, and this was a bit after my diagnosis, I've been living with this for 4 or 5 years now. But after my diagnosis, applying for jobs, and the first time I clicked on that optional, uh, you know, hey, tell us about your medical history thing, and I saw diabetes listed, it took me back. I was stunned for a moment. I'm like, oh wait, I suppose I do have a disability. I feel like a normal person. I felt like a normal person, right? I seemed like normal, except there's this thing inside me that doesn't work, and that can cause issues. And it's sort of, an invisible disease looking at me. There's no telling that I have this thing. There's no physical sign unless I have low blood sugar, and then yeah, you're gonna know. But otherwise, there's nothing here to say yes, no, right? And it took me a while to be okay with that, and it really affected what I applied for job wise. Some job applications didn't have it listed as a disability on that optional form again. And just seeing it there, I didn't know, a whole lot about the company's practices other than what the company was, obviously, I was applying for, but how much they weighed that, how much does it take away from their productivity, me needing a doctor's appointment every 3 months? I need an eye appointment once a year, and I'm out for the day because they dilate my pupils, and bright light hurts after they do that. Now, some people can get their eyes dilated and be fine. I need to wear sunglasses for like 5 hours after that because even just the regular lights in a room are too much. And so, yeah, just having a doctor's appointment can be a big deal um, in the productivity of a company. And having those thoughts is also weird. Like, no, wait, I'm protected. I have the right to go to a doctor. I shouldn't be thinking about this. But again, in my mind, I know that this is being looked at, whether it, the optional bit is not. And someone would have to know. Now there's advice on the internet. Of course, there's advice on the internet. I mean, where else? To not disclose you're diabetic until you're close to getting the job, and then just tell a few trusted people in there, and that, have a plan. And really, not everyone needs to know. You can do fine, but someone's got to know because things can go south for you, as they say, uh, and fast. And you need to have people that understand what's happening before it happens. uh, and that's hard and that's difficult. And I always feel like I'm putting more of a burden on others. But again, it's my life, right? We're here to help each other and grow. And sometimes it's very difficult to get through this. Every day, I don't know what else to say. I'm trying not to get too teared up about it. And it's scary. It really is scary because I, I have my backup plans. I do what I can to take care of myself, to have food I can eat available to me if I go somewhere. And, there's a little part of me that says I shouldn't worry about it. And there's another part of me that says, what if it all goes wrong? And I just, it takes a bit to learn, hey, just live your life best you can, whatever you need to do. And yeah, this takes a minute. Something appeared to have stopped there. Okay, so let's see. What else can I cover today? I think that was all I wanted to say about that today. If you have any questions, obviously I'm open to talking about it. So come on in. We're going to switch over to Bravely Default 2 in a little bit. Probably a few more minutes while I collect my thoughts. And wait if anyone has a question on anything. Yeah. Take a sip of my drink. Oh, another thing, diet. Don't tell a diabetic what they should and shouldn't eat. They have an idea. They're eating for a reason. If they're feeling depressed or anxiety, they may not be following their diet, but they probably will have ways to deal with the extra carbs. So yeah, is again like anything else, be mindful. Be mindful of the person around you that is diabetic and has to live with it every day. Because hey, surprise, not easy. I may look and act like a sort of semi-normal functioning human, but I'm not. I have medications I need to take every day. I need to make sure I have food, whether it's just a slice of bread, uh, just to make sure my blood sugars stay up. And again, the biggest thing I want to say, if you are diabetic, it is not your fault. Ever was. And I think a lot more people need to hear that. And productivity. That's a thing in this country. And I've been lucky to find some work that I can work from home. I was working from home before the pandemic started. I've been fortunate that just means I have a safer space to take care of myself in. And that's been wonderful, and I count myself very grateful for those sorts of opportunities that have come my way in order to do that. And there's a lot of people that don't have that choice, and that's why they need help of others and help with the employers. And just please, if you are wondering about your rights, I'll dig it up. I had a thing for it. I thought I had it bookmarked. And again, while I'm looking this up, my diabetes, my type 2, is not exactly the same as someone else's type 2. Certainly not the same as someone's type 1. That is very, very different. But basic thing is keeping track of blood sugar and carbs and knowing how to do that. So if you do need help, there is the American Diabetes Association. And I'll put that link into chat. If you're wondering about it, what it is, what it does, there you go. It's just diabetes.org. That easy. Look it up. Yeah. I mean, it's kind of even a big deal for me to be talking about this. Not something I thought I would talk about or express in any way, but it's something I think needs to be said, especially for other people that might need the help or just don't want to feel like they're alone. You're not. There's people. Just reach out. Look, I want to talk about this more, so more people have resources and just don't feel alone in it. You know, my diet, I've cut out a lot of in between snacking. I consider what I eat. I consider the amount of carbs a thing has in it. And however, if depression kicks in really bad, I stop caring. And well, that's not good for me. You know, I just there's a point where I do stop caring because that's how deep it gets. Doesn't get easier. Sorry, I had a notification I had to pay attention to. Yeah. So, like any other disability, you learn how to adjust life, how to live with it. And it's weird to me to say it's unusual to say I'm disabled, but it it's a disability. Um, and you need different care. And so please take your meds. Take your meds. Don't go to your doctor and listen to what your doctor says. No, don't mess with the homeopathic stuff. If there's a little bit that works for you and it happened, you think you feeling better on it and it doesn't affect your blood sugar, great. I'm not a doctor. I'm not here to tell you what what to do or not do, but I will say listen to your doctor and take your medication. Even if I don't want to follow the diet for whatever reason that particular day, I'm always taking my medication each and every day. So please, you're valuable too. Take your meds. Keep yourself around as long as you can. You're important. You're loved. You are valued. Don't let people take that away from you. And don't take that away from yourself. All right. I think that'll be that on that particular topic today. If anybody has any questions, please put them in chat. And again, I'm going to break out with it. If you're diabetic, it is not your fault. It is not your fault. Okay? Okay. All right. Thanks for listening to all this.